Welcome to In Conversation, folks. We come to you from Washington, D.C. My name is Ramesh
And I'm Anisha Abraham.
And the healthcare debate goes on. You know, President Obama went and talked to the doctors and comforted them that, look, we are trying to make sure we don't hurt you. But he does not want this defensive medicine going on. He did say that he may promise them some kind of a legislation that will protect them from these tort lawsuits, which is also a big deal. But, you know, looking at the whole picture, the entire world has taken care of their health care. How come America can't do it?
I think it's more complicated than that. We certainly do put a lot more money in for healthcare than probably other developed countries, but I also think there's a lot of inefficiencies in our system, and I think what Obama wants to do is to take a major overhaul and to really try to change some of what we're doing right now in terms of providing care for certainly the elderly, but also the very poor and the underprivileged, which, again, has been a real issue in this country.
Now, if it has been a problem, if it is complicated, my mind will say cut it out in small pieces, which means let the cities, let the towns, let the counties take care of their own people instead of the federal government getting into it. Because when the federal government gets into it, it's $300 million and all kinds of problems. But if a county gets in, it's like 4 hospitals. It's like maybe 200, 300 doctors. It's much easier to sort of take care of that then, instead of this entire pie.
The flip side of that is certainly if individual counties or states look at their issues, they may not see the big picture. They may not certainly learn best practices from other states, and that's, I think, why looking at it in a much global or federal way may be a better way to actually be approaching the problem.
Those people who live between the ages of 65 to 90, I mean, Medicare and Medicaid pays an enormous amount of money within that age group. So constantly we have a problem. So this is why I'm saying that there should be some state-based hospitals where you can send everybody. I mean, Canada has it, Great Britain has it, Europe has it. No one needs to have this most expensive care at all times, you know. I mean, we even give Viagra on Medicare. You know, it's got to stop somewhere, right?
Well, but the problem is we are sometimes providing very expensive care, but we're not also providing the best care, and we're certainly not providing care for a very large group of people. So there's huge disparities in the system, and yes, we're providing maybe Viagra for some patients, but others aren't getting birth control or maybe even very basic medications that they need to. So again, I think there is a real need, and this is the time for us to really examine what we're doing and hopefully have some very good solutions in terms of better health care for a much larger group of people.
I think instead of him taking over the car companies, I think he should take over a few hospitals.
That's an interesting issue, and I tell you as a physician that this healthcare issue is really one that's coming to hospitals and certainly coming and affecting patients on a daily basis. And people now can't afford the premiums or the co-pays for their medications or even to come for just basic preventative visits. And as a result, they're ending up in the emergency rooms for things like maybe asthma or other just very basic issues that really they should be coming into their primary care providers for. So I think, again, at a very basic level, we're seeing a huge problem in terms of healthcare.
Folks, I read an editorial in Wall Street Journal which was really interesting to read because IRS, back in 1989, passed a law that says whatever perks you're getting from your office, if they are personal, then you should pay tax on it. For instance, if you get a car from your office and some of the mileage you're using it from home to work, you got to pay tax on that. Same way, when you get a cell phone from your office or you get a computer from your office, you of course use it for your personal use, and IRS says you need to pay taxes on it. What do you think of that?
Well, that's an interesting dilemma. I certainly think as we are seeing that we need more and more transparency in terms of personal use, that it makes a lot of sense. And we know that in England, for example, there are a lot of lawmakers that got into a lot of trouble for perhaps doing things for a personal use and maybe kind of blurring the lines as to personal and professional.
Well, where do you draw the line, though?
Well, that's a good question. And I think a lot of folks do actually probably use cell phones and end up using it for other reasons. But I actually think that this concept of transparency and maybe taxing things that are given from work probably is a good idea. It makes people think.
The interesting thing is tomorrow they're going to say that the coffee that you drink at the office, if it's provided by the office, well, it needs to be taxed.
Bring your own coffee to work.
Yes, and like the airlines, I think one of the airlines started that if you want to use the bathroom, you got to put a coin in there, you know. I mean, it's more and more. I give you a very interesting story. The states are suffering from lack of funds because there are no capital gains in people's accounts. The unemployment is really significant. So they have taken a hit in the revenue side of it. So take for instance, California.
Which is having huge financial losses right now.
$40 billion. So they went to the Obama administration and say, can you please help us out, tide us over? And President Obama said, I can appoint a czar for you, but I will not give you the money. So these guys are suffering, so they're coming up with very creative taxes. For instance, did you know in many states, if you had an accident and the police came in, they will charge you $200 tax for that. If you had a fire in your house, the fire department came in, $600 for that. I mean, they are going wild out there. I have no problem, you know, I mean, if you're going to tax me, pay as you go, fine with me, then don't charge me property tax, don't charge me sales tax, don't charge me all of those things. This is really an interesting times that we are living in.
Absolutely. I think now we're having all these hidden charges. So again, you're not sure what emergency services and what charges you're going to get from each of these visits, whether it's the fire department or the police or anything like that. But I think people, again, are trying to be creative in terms of getting money when they don't have money. In other news, the housing shortage in India is widespread, and we know that many people, particularly around the slums of Bombay, live in shanty towns. And in fact, McKinsey and consultants recently came out with a survey that said that India needs approximately 25 million more homes. Well, now they have an innovative solution, and in fact, it's in the way of super cheap nano, which came to the Indians for those that had needed low-cost cars. Now developers are creating ultra-low-cost housing. Mathurin Realty has created low-cost flats that are about 50 miles from Mumbai, and these houses start at about $4,500. And Tata Realty, which also is the maker of the nano car, which costs about $2,500, are now creating low-cost houses, which are also near the Mumbai area, for about $5,000.
Wow.
So they're keeping the costs very low, and part of the reason they're able to keep the cost low is that they're using very low-cost materials. For example, they're using lightweight concrete instead of using bricks, and they're also making these houses very simple, so not very much one-layer or level homes that are easy to make and not using very skilled labor. But they're really hoping that they can now create affordable houses for the masses. Now, the other interesting thing is that in the past, one of the biggest hurdles for these low-cost houses, and particularly for low-income people, were the banks and trying to get financing for it. And what they're now doing is they're actually having banks that are willing to give low-cost financing